There's been a lot in the media lately about the high rate of suicide in veterinarians and the mental health struggles that a lot of us face.
I don't think anybody is immune to the stress levels in our veterinary practices.
This is time for us to really start talking because we have enough data under our belts to really start talking about what we're going to do to change what's happening.
There's a lot of myth and it just confusion surrounding compassion fatigue just by itself, let alone suicide. Is the risk as high as we're being led to believe? Is it not as bad? Where are we?
Well, so we have a lot of data that's been coming out probably for the last 10 years now that really is starting to indicate that we need to have more open conversation about suicide in this field. And really we have lots of studies now starting to build up that are indicating that in veterinary medicine we do have a much higher risk of suicide than the general population. That of the helping professions, it does have one of the highest risks of suicide as well. We do know that now we have pretty high rates of psychological distress within the field, and particularly for younger practitioners and female practitioners.
Everything in life was about work, and there wasn't much space that I was leaving open for life and everything else. And I became very burnt out. And so it was after that 5-year period that I decided that I was going to make a change in my life. And it really shifted my feelings towards balance in the vet profession. So my interests have really shifted towards how can we enhance wellness in the profession, and not just talking about the issues that we know are present, but what can we actually do about them.
How do we tell someone that we're seeing, hey, it looks like you're struggling, why don't you take a 5-minute break? And they're like, I'm not going to do that. How do we really encourage that? What do we do?
I think that's hard to do because certainly when they say that to you, they might get embarrassed, or they might say, I'm doing fine, because they don't want to show their coworkers that they're not doing fine.
And most of us, let's be honest, when we pass each other in the back of the house, what we say is, I'm fine. Yeah, I'm fine. Yeah, I'm good. Even though we're not.
I have sometimes gone into another room, and if they're in a room where there's a phone, I'll call down and say, hey, is so-and-so there? And talk to them and say, hey, I need you, can you come up and talk to me? So I've actually pulled them out of a situation where they're in front of other people and said, come up and sit by me for a few minutes, and have them just come sit by me, and I'll address it one-on-one.
If you're really concerned about somebody and you ask them what's going on, I'm really worried about you, and they start telling you that they're really in trouble, what do, right? So the model that we train on at NC State University is QPR. It's question, persuade, refer. And it's based on the idea and the research actually that community intervention, community prevention is more effective than anything else we have. So you don't have to be a mental health expert to have these conversations. When we say to someone, I'm really worried about you, are you okay? And they say no. Then the best thing you can do is get to a quiet place with them and say, I'm really concerned, tell me what's happening. It doesn't mean you have to fix it. It doesn't mean you're going to know exactly what to do, but it does mean that you need to open the conversation so that someone has someone to talk to. When people are feeling really desperate, they're incredibly isolated, and they believe that there is no possible solution to the pain they're in. And so one of the ways we can prevent someone from taking additional action is by talking to them.
Recognizing that sometimes they can't even pick up the phone to call, and saying to that person, you know what, I'll go with you. I'll drop you off, I'll drive you, I'll take you, or I'll make that phone call for you. That can help a person who's really, really having a tough time.
People need to feel important. They need to feel like they're seen. They need to feel like no matter what they say to you, you're not going to be shocked and you're not going to run away. And so I often will say, it's okay for you to tell me what's happening. It doesn't mean I can fix it, but I do want to know. I want to know. And then it's really important to get help because I care about what happens to you and I don't want anything bad to happen to you. Just being a good friend, a good colleague and a concerned human being is one of the best protective factors we've got. And so that's probably the most important message we can get across.
I think we need to keep talking about it. I think we need to keep doing this at veterinary conferences. I think we need to keep addressing this in veterinary schools. And then I think we need to make sure that there is a lot of support systems all over the place that they know that they can go to if they're feeling like they're in trouble.